Hello, everyone, and good afternoon once again. Dr. Alalade here at AsktheGynaecologist, and I want to say welcome to everyone today. It's been a while I've been on Facebook and on Instagram. I've been on call all over the weekend, and it's been very, very hectic. So that's why I've not been able to consistently be online over the last few days. But first of all, we want to thank God for the gift of life. And also, I want to say welcome to you all and thank you so much for your perseverance, understanding. It was a very busy on call over the weekend. I was hoping to be able to come up live a few minutes before I go to work, but I tried my best. It wasn't happening as those calls that I did were extensive and very, very busy. Couple of ectopic pregnancies and crash cesarean section made it a bit hectic for me, but I'm happy. I'm grateful because Facebook is not just all we do. Um, Sometimes I work in the hospital regularly, clinics, and it's not always be easy to be online. But I want to say thank you everyone for your presence here. Yesterday we witnessed a chaotic evening. I was hoping to come up live yesterday evening, but all of a sudden, when I got home after coming back from doing some groceries, I put on my Instagram, WhatsApp, just like everyone, and there was nothing happening. I thought it was my home network. Checked it, but still yet no connection, and I thought there's something wrong. Tried to connect my phone with my other phone to use the Bluetooth, still yet nothing worked. Then suddenly I saw the news that there's Facebook issues. But the amazing thing is that everything was down: Facebook, Instagram, and WhatsApp. And those are all the three portals we use in ATG for our consultation discussion. You can see here we are on Instagram, we are on YouTube recording, we are on Facebook, and we also talk to people on consult line on WhatsApp. Everything was down. It made us realize how important, how vital Facebook is to our businesses, to our lives, to our well-being, and to our social networking. Facebook is paramount, it's important, and it's something that we can't do without. And I really was shaken, and it made me to re-strategize and to rethink of our business models and how we reach out to our patients. So I want to welcome everyone today. Wifey 16, Liz Queen, Omad Ahmed Shama, Sovia Abogunrin Tochuku, Vivian Diko Briggs, and every other person watching me. Tonight, this evening, I'll be talking about a particular infection that has been implicated in miscarriages. Give me 1 second, please. Just 1 second. 1 second. Yeah, excuse me. So a particular infection that has been implicated in recurrent miscarriages. So I'll be talking about that infection today, how it can be treated, what are the obvious signs of them, and how they can be addressed, and when can they cause problems, in pregnancy. So I'll be talking about these things today. So anyways, I was talking about this yesterday, made me to change things. That what is really going on? Facebook is down. Instagram is down. WhatsApp is down. Everything we use. So I had to quickly use Telegram yesterday for some few things. But the fact is that most people don't use Telegram as often as we think. And this other one, Signal, is not well populated. We are not using them. So I realized that we need to start using these things, and also to accelerate the delivery of our own ATG app so that we can consult on our own native ground. Having an ATG app is a serious digital real estate that is non-negotiable, which we are really working towards. Our iOS is the problem. The Android has been approved about 4 or 5 months ago, but the iOS has difficult route. It's so difficult to get them to approve, to review, and all these codes. So, but we are working every day with them. I reached out to the team in Dublin today to see how they can get the app completed. So we are working on this thing. So first of all, I want to say good evening to everyone. It's a pleasure to be here. I'm so grateful, and thank you so much for spending your time, most importantly, your data to listen to me on ATG. My name is one and only your Dr. Alalade, Dr. J, and it's my pleasure to be here this afternoon to discuss with you these things, this infection that is known to cause recurrent miscarriages. Now, if your name is not appearing yet on my feed on Facebook, don't worry. I can see it now on Facebook. Initially, there was no feed on my Facebook, but I can see Rose Young, Chidima Unu, Comfort Dennis, Messi Wosu Inkiri, Lizzie, Okwoha Udensi, Messi, Chikodi. Okay, sorry, my volume is not good. Okay, can everyone hear me now? Chikodi, Vivian, Matthew, Yusuf, Ayikeade, TY, Eli, Olam, Dupsy, Classic Makeover, Marilyn, Amadi, Omalara, Opeyemi, Ekiyoyo, Amak Olisa, Onwa Olisa Ugonaya, Zinat Abdullahi, Chizi Evan, Ogochuku Uche Ohalete, Omalara. And we have Mofolua on Instagram, Best Ann for Real, Christy Beck, Christina, she can hear me loud and clear on Instagram. Marilyn, Amadi, thank you. So we are working towards that anyway. Now, it has been known that there are two particular infections in the vagina that are very, very notorious. The first one, which is the group B Streptococcus, which is an infection. Number one, I will talk about it later, is very, very bad in the sense that it doesn't cause any problems in most cases in pregnancy, but at the point of delivery, when baby is on his way out or on her way out, they can contact group B Streptococcus. Streptococcus, not Staphylococcus. So it's not Staphylococcus, it's Streptococcus. Let me write it on my board so you can see me. So now, I'll write it here quickly. Streptococcus. Okay? Not Staphylococcus. Okay. So people need to see it here on Instagram. So on Instagram, you can see here is Streptococcus. Okay? Not Staphylococcus. Streptococcus, not Staphylococcus. Okay? Now, this infection, okay, is very, very notorious to cause problems. They live in the vagina. They don't cause any problems. If we find group B, we call it GBS, okay? GBS. Group B Streptococcus. Group B Streptococcus. If we find it in your urine, yeah, it's written backwards because Facebook interposes the picture. By the time we edit the video on YouTube, you see it is going to be exactly as it is. So everything you're seeing, even me, I'm reversed. I'm backwards. Yeah, I agree. I'm seeing you forwards. Don't worry. So GBS, which is group B Streptococcus, okay, lives in the vagina most of the time. They don't cause trouble. They are well under control, similar to Candida. But Candida doesn't cause much problems. But GBS, when baby is born vaginally, okay, on their way out, okay, they can contact them. If baby is delivered through cesarean section, GBS is not a problem. Group B Streptococcus is not a problem because baby will bypass vagina if they are coming out through cesarean section. All right? And if we find GBS, that is Streptococcus, not Staphy, Streptococcus. If we find it in your urine sample during pregnancy, we treat it. And also, not only treating them during pregnancy, at any time they are found in the urine, whenever you are in labor and you are delivering your baby vaginally, we start you on some antibiotics through your veins, penicillin to be precise in most cases, where we can use other ones if you're allergic to penicillin, which is very rare. We can use another antibiotic, okay? This antibiotic must be given in your vein at least 4 hours before you deliver. Some people come in labor, they deliver very quickly, but we also ensure that you get the antibiotic in your vein at least 4 hours before you complete your delivery. These antibiotics goes into your body to treat the infection so that your baby does not contact them whenever they are on their way out through the vagina. So these antibiotics, okay, penicillin, okay, is given to you in your vein. And if you're allergic to penicillin, we give another one called clarithromycin through your veins to treat the infection so that baby does not contact the infection on their way out through the vagina. If baby is coming out through cesarean section, there's no need for that antibiotic. Now, this is the first infection that we're talking about today. The other infection I'll talk about today is the other one called Bacterial Vaginosis. Now, this one does not cause trouble at delivery, but it causes trouble in your first and second trimester, especially in your second trimester, by causing miscarriage. Okay, the first one I talked about, the GBS, Group B Streptococcus, can cause baby to have infection when they are born, and it can cause some babies to die. Very rare, but it can lead to death. The second one, which is the Bacterial Vaginosis, can infect baby before labor happens, can infect baby before labor is completed, can infect baby during the first, second trimester, and if they cause infection in the first trimester or second trimester, they cause miscarriage, okay? That is the one I'll focus on secondly today, and we'll talk about how to treat them, okay? So now listen attentively. The second one is Bacterial Vaginosis, okay? That's the one that makes the vagina smell like a fishy smell. If your vagina is smelling like a fishy smell, you're noticing greenish discharge with your vaginal discharge, it could be a sign that you have Candida or Bacterial Vaginosis. For such cases, get swabs done, and if we find infection in your vagina, we might need to treat them as soon as possible, most especially in your first trimester. If you're suffering from recurring miscarriage or you have miscarriage in your second trimester, you've had miscarriages before at 14 weeks to 15, 16 weeks, and we do swab. That is why whenever you have a miscarriage, some things must be done at the point of miscarriage so that we can get some information and, if possible, to prevent further things in future that can lead to miscarriage. So if you have a miscarriage, it's always important that we take swabs from your vagina at the time of delivery of that miscarriage so that we can know whether this is what caused the miscarriage. And in such cases, we give antibiotics to treat and to prevent such in your next pregnancy. Somebody's asking the name of the first one. The first infection is Group B Streptococcus, or just call it Streptococcus, not Staphylococcus, so Strepto. E, not Staphy. E, okay? Now, let's focus now on these infections themselves. First of all, these two infections, they are bacterial infection. You know, you can have infection from many, many things. You can have a viral infection, which, for example, like HIV, herpes, they are viral infections. You can have bacterial infections like bacterial vaginosis, like gonorrhea, like a group B streptococcus, staphylococcus. Those are bacterial infections. We also have fungal infection, for example, like the chlamydia. Chlamydia is a fungal infection. We can also have infections that, so those are the main infections we have. The viral infections, the bacterial infections, and the fungal infections. Those are the common ones, okay? Am I correct? Bacterial infection, for example, BV, bacterial vaginosis, staphylococcus, streptococcus, that's bacterial, viral, herpes, HIV. We have the fungal, candida infection. Then we also have parasitic infections, not important here. Malaria is a parasitic infection. We also have some what we call the chlamydia. They are under a special group, protozoans, okay, basically. So those are common infections. Those are their groups. So today we're focusing on bacterial infections, which are number one, bacterial vaginosis. So good evening, Joy Chidi Ubudegu, Angela Raymond, Precious Mwaibe, Afebi Agata, Jashan 123 from India, I think, Bridal Clutter, Miss Chubby, and so on and so forth. You're late. I'm alright, don't worry. You can watch the video over again or listen to me as we continue. So these are the infections I'm talking about. The bacterial vaginosis, one, and the what? If you're following me, text it out. First of all is bacterial vaginosis, and the second one, which I mentioned first, was what? Group B Streptococcus. Okay, now let's start with the GBS. GBS is Group B Streptococcus. There are many groups. We have the group A, we have the group B, we have the group D, and so on and so forth. I think we also have the group C. So basically, GBS lives in the vagina. In fact, many bacteria, they reside, they live comfortably in the vagina. Okay? They can cause discharge. It's not transmitted through sex. Okay? GBS is not through sex. Okay? They can live in the vagina comfortably and they cause no problems. In fact, many bacteria, they live in the vagina and they don't cause any problems at all. They just live there. At different times in your menstrual cycle, they increase in size and they fall in size depending on your environment in the vagina. Okay? And they don't cause hassles. You can have sex, they don't cause pain. You're not moved by infection from man to man or woman to man. They just live in vagina. And in most cases, with good vaginal hygiene, they don't cause any problem and they go away. Your body overcomes the infection and they're treated easily. In very rare circumstances, they can move into your urine through your urethra. The urethra is the arch opening where you pee that opens into your vagina. The belief is that if GBS can move from vagina into your bladder, into your urine network, into your urine, if they can move from vagina there, that means that GBS is very bad, it's aggressive enough, it must be treated. That is why if we find GBS, that is Streptococcus, in your pregnancy, in your urine, that GBS must be treated at that point as soon as possible. And also, whenever you're in labor, aiming for vaginal delivery, we also give you antibiotics through your veins to prevent transmission of that infection to your baby whenever they're on their way out through the vagina. If you're going to have a cesarean section delivery, there's no need for giving you antibiotics before your baby is delivered. And if you got GBS in your urine sample, we treat antibiotics, okay, and we give you that antibiotics at least 4 hours before delivery. Very important. Now, if we find GBS in your vagina, okay, during pregnancy, no big deal. As far as it's not causing you any problem in your urine, it's not found in your urine, what we need to do is just to give you antibiotics at the point of delivery. Because the fact is that when babies on their way out, they go through the vagina, they can easily aspirate, contact, or get infected, okay, just through direct contact. As they are passing out of vagina into the world, they can get contacted by that GBS in their mother vagina, and they can overcome it. But in some few cases, they succumb. They have infection. For such, we also observe the baby at least 24 hours before baby is discharged from the ward. Now, do we need to screen every woman for GBS in pregnancy? Yes and no, depending on the country you are. For example, in UK here, we don't screen. But if we find that GBS in your vagina, if we find the GBS in your urine sample, opportunistically. So, for example, you come to the ward complaining of something else. We do swabs in vagina and we find GBS there. We start to treat. If we, we give you we do swabs, okay, and now we find the infection in your swabs, okay. We start to treat you with antibiotics as soon as your labor starts. If it's not found in your vagina or it's also found in your urine sample, we give you antibiotics at the same time and treat when you go into labor. If GBS is only found in your vagina in pregnancy, antibiotics is enough during labor. If it's found in your urine sample, we give you antibiotics at that time and also in labor. This is now the Royal College standard now. For countries like America, there's a time in pregnancy they routinely screen for GBS. And as start to be corrected, that's usually around 28 weeks, and sometimes they repeat it again around 34, 36 weeks. They repeat GBS swabs in the vagina just to check, because if the baby has that infection, it can be a cause for litigation in the courts in America. And people don't like litigations in America, so it's standard now, they do GBS screening, fact, in America, whenever you are pregnant, and they give you antibiotics to treat it. Now, GBS does not cause miscarriage, but if it infects baby on their way out during vaginal delivery, it can cause baby to be very sick when baby is delivered. And in few cases, some babies can succumb to the infection and they can die. That is where GBS is very important. That's why it needs to be attacked aggressively if it's found all the time. Now, the other one we're going to talk about is the bacterial vaginosis, where, and in that case, if it infects your baby while you're pregnant, it can cause miscarriage. And I think that's what most people are interested in today. No big deal. Now, bacterial vaginosis, from the name, you know, it's already called bacteria. That bacteria is notorious for the fact that it causes miscarriage if you have it and it moves into your womb cavity during pregnancy. It can infect the water around the baby, transmit the infection to the baby, and it can cause baby to miscarry, to die, even before they are born. So those babies, even before they are given opportunity to be alive, they die. And that is found and is very common to cause consistent recurrent miscarriages. Whenever we find bacterial vaginosis in your vagina in pregnancy, we attack it, we treat it to prevent. And the treatment is very simple. Metronidazole, which you can swallow, or you can get it as a vaginal cream called Zidoval, inserted into your vagina at night for about a week. So bacterial vaginosis can be attacked, treated with Zidoval antibiotics in your vagina, or by swallowing the antibiotics through your mouth. Simple, it clears it off. Okay, if you've been having recurrent miscarriages, okay, and we don't know what's causing it, and we think you have any offensive discharge at the point of this miscarriage, we usually ensure we even start the antibiotics automatically to prevent miscarriages from happening again. Now, one of the causes of miscarriages in mid-cycle, second trimester, like I said, is bacterial vaginosis, but there are other causes too. Causes like incompetent cervix, causes like chromosomal abnormalities, causes like submucous fibroids, and so on and so forth. Causes like other infections in pregnancy. That is why if you're pregnant, you should be registered for antenatal care with a good gynecologist that can look after you antenatally. And if you don't have, we always have antenatal Telegram group on ATG where you can ask questions from Dr. Esther and she can guide you along during your pregnancy. So if you're pregnant, why not join that? Why delay? Not expensive at all. For a token, you can join that group for the whole 9 months. Okay, now let's leave that aside. Why would you want to get pregnant? Go through all those difficult times and from vomiting in pregnancy, get to the second trimester, then develop problems which you can prevent yourself. So if you follow me, you should be registered with a good antenatal doctor, gynae obstetrics doctor, to look after you during your pregnancy to prevent all this, or to know if you have all this and get it prevented. I'm going to open the floor now for questions because people want to ask questions about these two things I've mentioned now. So if you have questions now, put them on the screen, but do it one after the other so that I can read the questions, interpret them, and answer them concisely before another question pops up. So slow down your comments, your questions, so I can see them, I can answer them, and we can get all settled this evening. Now, if you're watching my video, maybe sometimes in the future, we're going to answer questions now. People are going to put up their question on the screen. I will answer them, and then if you have any issues, you can always get across to me on our Facebook page, on our email address, or through our premium services, and I'll consult with you. Today at the ATG IVF Center, I had to discuss with the family on their way forward for IVF at our center, and it was a bit emotional for me because I spoke with the husband, with the wife, and with our IVF team in Nigeria to see how we can make this family smile. And I had to go through their story, and it was very important that we offer them a discount, which we are working towards. Now, there's a question by Leonard Precious. He's asking a question that, how do you know if you have bacterial vaginosis? First of all, you're going to have a greenish discharge in your vagina. Secondly, it's going to smell like a fish. So as soon as possible, get swabs done to know if this is so. And if it's so, get it treated without delay. Okay? Good evening, doctor. If you need a John Ago, what causes miscarriage? In most cases, allow way it does. Most causes of miscarriage means that there's no bleeding, there's no pain. We went for scan, there was no heartbeat anymore, and then you don't know what happened. So miscarriage, that is miscarriage. It can also be called missed abortion. But the causes in most cases can be failed implantation, failed placental support. It can be chromosomal abnormality. Sometimes it can be from submucous fibroid that is so big in your womb cavity. Sometimes it can be because of an infection, chlamydia, gonorrhea, or even bacterial vaginosis. This can cause miscarriage. Okay. Yep. Let's take some questions quickly before we go. If you want private consultation with me for the month of October, yes, you can get subscribed. We have a lot of services available. The consult service, that is for the month, the consult for the weekly. We have the gold service for a year. We have the diamond service, which is for a year as well, and the platinum service. Everything has different grades. You can choose whichever one that suits you, works for you, pays you, and you can join. So, a question here by Linda Edwin. She's asking that can Staphylococcus prevent pregnancy? No. Staphylococcus does not prevent pregnancy. Okay? Except in very rare circumstances. Very rare circumstances have I seen Staphylococcus causing infertility. What causes uterine polyps? Honestly, we don't know. Polyps, just like fibroid, we don't know exactly what causes them. But we've realized that most people that have fibroids, they also have polyps as well, or they develop polyps at some point. Can one categorize tubal spasm that was diagnosed with HSG after miscarriage to blockage? Can one categorize? I don't understand that question, my sister. It's Agege Frida. Good evening, please. Can someone with 0.5 progesterone use clomid? You can use clomid, but ensure that you get follicular tracking scan done to check that your ovaries are not responding badly to your clomid. Is it possible for BV to cause preterm labor? Yes, BV can cause preterm labor. Yes, it's true. Okay, but before you use clomid, just ensure that you register with the doctor and you're doing follicular tracking, please, so you don't kill yourself. What causes 14 weeks miscarriage? Because this one occurred twice. It could be recurrent miscarriage from weak cervix, cervical weakness. It can be from bacterial vaginosis. What causes discharge? Any infection, bacterial, viral, can cause discharge in your vagina. How long will it take to get pregnant after treating cervical stenosis? Within 6 weeks, you should be able to get pregnant within 6 weeks. What causes cervical stitches during pregnancy? What causes cervical stitches? I don't know what that is. Maybe you had a tear in your cervix during delivery and we have to stitch your cervix. Maybe that's what you mean. Can I use clomid without prescription? No, you can't use clomid without prescription. Don't try it. Never ever use clomid without prescription. Never ever use clomid without prescription. Does infection or hormonal imbalance cause apoplastic uterus? No. Infection, hormonal imbalance does not cause apoplastic uterus. Apoplastic uterus is found in people that have diseases like Turner syndrome, where their womb is not developed or well developed. Those are very rare things. We call it in Turner syndrome. People can have apoplastic uterus. Can candida prevent pregnancy? No. Can candida be given to your husband during sex? No. Okay. What are the recommended tests to do to check the causes of miscarriage? If you're having a recurrent miscarriage, okay, the first test you should do is what we call chromosomal genetic analysis of the daddy and mommy, number 1. Number 2, vaginal swab to check for possible infections. Number 3, thrombophilia screen to check for abnormalities in the blood that is known to cause recurrent miscarriage. We need to also, whenever you get pregnant, to do cervical length scans to see if your cervix is shortening or weak. But that can be done only when you get pregnant. We call it cervical length scan to check for any weakness in your vagina, in your cervix, in pregnancy, and that can only be done during pregnancy. We can't do cervical length measurement before you get pregnant. What are the recommended tests to do? Yes. So I'm just answering you. Yeah, Alaway with Doris. Thank you for answering my question. Yeah, thank you. What infection causes darkening period? No infection. Infection does not cause darkening period. Maybe you have fibroid, maybe you have cervical stenosis, or maybe you have endometriosis, or adenomyosis. Infection does not cause darkening period. Can one take letrozole without prescription? No, you can't take letrozole without prescription. Don't even try it. Can hormonal imbalance cause miscarriage at second trimester? Very unlikely. What is the solution to 14 weeks miscarriage? Solution is to do genetic studies for, if it's just one miscarriage, it's no big deal. But if you're having a recurrent miscarriage 3 times in a row for the same man, it's time to do tests. Thrombophilia screen, genetic analysis test for husband, daddy, and mommy. So we check for vaginal swabs for infection, and if possible, we do chromosomal studies on that miscarried baby. We do some tests on the baby to know if there's any hormonal imbalance, if there's any genetic abnormality in the baby. Please, doctor, is it possible for morning sickness to disappear before? Yes, it's possible for morning sickness to disappear at the end of first trimester and even to come back at the end of second trimester or third trimester. With 12 weeks pregnant, but had spotting for a day, went away. 12 weeks pregnant, get a scan. As far as my baby is well on the scan, I'm happy. As far as there's no further bleeding, that's okay. My gynae consultant here in UK said there's nothing called incompatibility in spouses. Is that true? It depends on what it's saying. You see, it's easy for you to misconstrue your doctor in UK. anywhere, based on what you know. See, we interpret things based on our experience, based on your outlook of life or your experience in life. That's the way you're going to interpret things. That's why it's always good to increase or to enlarging and widen your frame of reference. Your frame of reference is determined by your experience or your exposure. Now, there's not, your doctor can't say there's incompatibility. Incompatibility that is sane, okay, is possibly, I don't know. But if you have genotypes like SS together, father and mommy, daddy and mommy, or husband and spouse, or wife and husband, or you have AS and AS, don't get married. That's the honest truth. There's no debate about that. Apart from that, I don't think there's any other incompatibility that I know. I could be wrong, but I don't think there's any other incompatibility that I know. Does stomach ulcer cause problem in pregnancy? Very unlikely. But if you have ulcer in pregnancy, get it treated, okay? If one's progesterone is 1.5, can it carry pregnancy through 9 months? If your progesterone is low, best thing is to get it treated before you get pregnant, okay? And if it's too low, it can lead to miscarriage in the first 12 weeks of pregnancy. You had 4 miscarriages, then it's time for you to do all miscarriage tests, thrombophilic screen, genetic studies on that pregnancy that you miscarried last, vaginal swabs, and all that. That should be done as soon as possible. What causes irregular ovulation? Probably polycystic ovaries. What can be done to increase apoplastic uterus to carry a baby? First of all, if you have been told that you have apoplastic uterus, then they must know why you have it. It's always good for you to do genetic screening test, because you probably see only 1 in 20,000, 1 in 30,000 of women that have Turner syndrome, or even less than that. So for someone to have apoplastic womb, that means that womb is too small. That means we need to start screening for Turner syndrome. And if indeed the woman has Turner syndrome, the woman will probably have problems getting pregnant. Or if she gets pregnant, she probably needs IVF. And if she even gets pregnant, unlikely to carry the baby till full time. If you got Turner syndrome, I think you're probably not here to discuss with me, because if you have Turner syndrome, you might probably not be able to hold this conversation or this text with me on the phone. What could make someone to see menses first month of pregnancy? You can't see menses in your first month of pregnancy, and nobody sees menses when they are pregnant. If you are bleeding in pregnancy, you got threatened miscarriage. Any bleeding in pregnancy is called threatened miscarriage. I repeat, you don't see period in pregnancy. Once you're pregnant, you should see blood only at the point of delivery. If you see bleeding at any time in pregnancy, it could mean miscarriage, or it could mean that you have placenta previa that is causing the bleeding. Okay, so nobody sees bleeding in pregnancy and calls it period. It's not period, it's miscarriage that's about to happen. But if you have bleeding in pregnancy, it doesn't mean you're going to miscarry. It just means that you might miscarry 30%. 1 out of every 3 chances might miscarry. Okay, what causes blighted ovum? I already mentioned it. Blighted ovum, the causes are very similar to miscarriage: infections, failed implantation, genetics abnormality problems, maybe with baby, and so on and so forth. Even infections, they can cause blighted ovum, and they can even uncontrolled diabetes, uncontrolled hypothyroidism, uncontrolled blood pressure, or taking medications that are incompatible with pregnancy. They can cause blighted ovum or blighted ovum in the first week. Your period was not seen when for test of pregnancy. After 2 scans, you were told today not seen. What's the problem? If your pregnancy is less than 7 weeks, they won't see anything on scan. In fact, if your pregnancy is less than 6 weeks, most scans will not pick pregnancy. If your pregnancy is less than 6 weeks, okay, most scans will not pick the pregnancy. Okay, what causes the womb lining to drop from 8.2 to 6.9? Probably you just finished your period. Doctor, what is the cause of blighted ovum? Damilola Olanwaju, I already answered your question. Damilola Olanwaju, I already answered your question. Shola Oyefuli, all the way from Pennsylvania, United States. Thank you, Shola. How are you? Long time I've seen you here. I hope you're doing fine, and I hope you're having fun time. So Shola Oyefuli, a wonderful lady. She's a wonderful person. She's a good follower of ATG, and she also sells. I mentioned this on Instagram, and I follow her all the time. I haven't seen you in a long time now. I hope you're doing fine, and thank you so much for buzzing into the hello to you. Chizoba Jennifer is saying that pregnancy was not seen for 2 months. Now 2 months is about 8 weeks. Negative test. That means that you're not pregnant. Okay, you've gone scan, you can't see scan in pregnancy, they can't see pregnancy on the scan. You've done your test, pregnancy is negative, then you're not pregnant. You have hypolactin. Hypolactin will make it not to have regular ovulation. And if you're not having regular ovulation, getting pregnant is a challenge. What you need to do is to treat the prolactin. Once the prolactin is treated, you're going to have regular ovulation and you're able to get pregnant, all things being equal. Hoping that your husband's sperm is okay, that your tubes are not blocked, and everything's working as it's supposed to be. You're going to get pregnant. Okay? Doctor, I didn't get what you said causes irregular ovulation, please. I said polycystic ovarian syndrome, PCOS, polycystic ovarian syndrome. Shala, you're welcome. Shala Oyefule, you're welcome, my sister. God bless you. Thank you. What causes frozen embryo not thawed? Maybe the technology that was used to freeze the embryo, or maybe the embryo has genetic problems. Okay, but frozen embryo, once it's taken out, they are thawed without problem. If it's not able to thaw, that means that probably the egg was taken to some Eskimo place. I don't know. I'm just joking. Excuse me for that. Now, once embryo is taken out of that chamber, they will unthaw. There's a way we unthaw them. So I don't know what is going on. Can tubal spasm cause blockage? Tubal spasm is this, like when you touch an earthworm on the ground on a rainy, when we were all small, you see earthworms walking on the ground whenever it's so there's much rain. The same thing too. You touch the earthworm, it goes into spasm shock and it stops to move. It's scared. Or you touch a snail and they retract suddenly into their shell. The same thing with a crab. It's shock. Okay, that is what we call spasm. Once we flushing the dye contrast into your tubes during HSG, sometimes it irritates the tubes and it causes spasm. That's when you have pain during HSG. That's why it's always good for you to be reassured, carried along, good communication with the person doing the HSG, and we give you some painkillers before coming for the HSG. I do HSG all the time, almost every week here, every week in UK. I do that in the X-ray department, and I realized that if a patient is carried along, what to expect, and so on and so forth, they're usually able to tolerate the procedure, and we have less cases of spasm, tubal spasm. It's only in a few cases that we don't carry the patient along very well. We don't use good painkillers, analgesia, that people develop tubal spasm during the procedure. Okay? You're bleeding in pregnancy, there's a risk of miscarriage. Austin, Darari, you're bleeding in pregnancy, it means that you have what we call threatened miscarriage. You go for scan, check the scan. Usually when you're above 7 weeks, we'll see the baby heartbeat on scan. If we can't see it, there's a chance that you might be miscarrying. If you're less than 8 weeks, 7 weeks, we can't see pregnancy on scan. We repeat the scan 10 days or 14 days time to see that is this pregnancy developing. And at that point, we should see heartbeat. If we can't see heartbeat, then no big deal. There's a chance you might miscarry. Now, if you bleed in pregnancy, 3 things might happen. Number 1 is that the bleeding stops and you're able to carry the pregnancy till the end. I've seen people like that, they bleed in pregnancy, first week, bleeding stops, and there's no further bleeding, and they carry pregnancy till the end. Another set of people, they bleed in pregnancy and they bleed intermittently all through pregnancy, and they are fine, baby is fine. Another set, they will bleed and they will miscarry. And another set, I don't know what happens to them. If you put 10 women together, okay, 3 will bleed and it will stop. 3 will bleed and they bleed intermittently all through pregnancy. Another 3 will bleed and they will miscarry. Another 1 we don't know what happened to them. They ran away. They won't come and tell us what happened. So that can happen in any pregnancy, in any subset. In fact, most people that bleed in pregnancy, you can see from statistics here, they'll be okay. 60% of women that bleed in pregnancy, they'll be fine. Out of every 10 people that bleed in pregnancy, 6 of them will be fine. That's a very high number, high statistics. So you'll be okay. If you want to contact me, use our premium services, I consult with you. If you want one-to-one consultation through my WhatsApp number, you can go through the premium services, okay? What can you do to ovulate regularly every month? First of all, we need to know why you're not ovulating regularly every month. We do your hormonal profile to see why you're not ovulating. Whatever is high, whatever is abnormal in your hormonal profile, we'll fix it. If we fix it, you're able to ovulate most cases. Most healthy women that are still within their reproductive age group ovulate regularly every month. In fact, if you're having a regular period, you're likely to be ovulating almost 80 to 90% of the time. Except in few cases that people that have polycystic ovarian syndrome, people that are obese, people that have issues with their womb, people that have endometriosis, very, very, very rarely, other hormonal imbalances, having other medical problems, renal problems, kidney problems, or people that have uncontrolled diabetes, they can have irregular ovulation and they can have a irregular period. Can salpingitis cause infertility? Yes, if salpingitis, which is, salpingitis means infection of your tubes. Salpingitis means tubes. Salpingitis means infection of the tube. Once your tube gets infected, there's a high chance that your tubes could be blocked. And if your tubes are blocked, it can lead you to not be able to get pregnant because there's no way the eggs that is released from the ovary will pass through the tubes to get into the womb. That is why salpingitis increases the risk of difficulty in getting pregnant, infertility. And the more you have recurrent infection, the recurrent salpingitis infecting, damaging your tubes, the more your tubes are damaged. You have one infection in your womb cavity, one infection in your tube, damage. Another infection is that same place, damage. 3 infections in that same place, blockage. So the more infection you have, 1, 2, 3, anyone can cause blockage of your tubes. Prolactin is 57, is too high, get treated. But once you're pregnant, your prolactin goes up because your body starts to get ready for delivery at the right time and to make your breast milk get your breast be productive to produce breast milk. Prolactin helps the breast to get ready to produce milk for baby. So once you're pregnant, your prolactin starts to creep up. Prolactin is useless to be measured in pregnancy. Prolactin is useful to be measured before you get pregnant. Once you get pregnant, we don't measure prolactin. It's useless. And in fact, it's not necessary. Once you're pregnant, prolactin is gone. Prolactin in pregnancy that is high does not cause miscarriage. Prolactin doesn't cause miscarriage even outside pregnancy. Prolactin can make you not to ovulate and then not get pregnant. But once you're pregnant, measuring prolactin is useless. It's not useful anymore. Okay? Thank you everyone for being here today. I really appreciate you. I will see you again tomorrow by God's grace, okay? Thank you once more. I'm Dr. Alalade, one of your admins here at AsktheGynaecologist. I want to say thank you so much for following us. Yesterday was a bit chaotic. Facebook, Instagram, WhatsApp, all down. But we're back on live today, and by the grace of God, as long as God wishes. Hope to see you soon. I want to say one thing. I love you all. And thank you so much for spending your time and data to listen to me today. God bless you. See you soon.